All right. Thank you. Just reminding this meeting is being recorded, so everything shared in the meeting or as part of the recording, both online in the video or chat, is part of the permanent recording that is shared to the Bureau's website. Shelley, if we can do roll call, please.
Brian Smith.
Present.
Brian Stephen. Chris Salvino. Dale Woolridge.
Present.
Dan Spate.
I'm here.
Deb Skarambe.
Present.
Edgar Bissonette. Franco Castro Marin.
Present.
Gail Bradley.
Present.
Garth Gamer.
Present.
Gina Shira.
Present.
Glenn Kasserthick.
Good morning, President.
Heather Miller. Eve Godstinker. Jesse Torres. Jonathan Madams.
Present.
Nick L.
Present.
Raymond Ochoa.
Present.
Rodney Reed.
Present on the phone.
Thank you. Roy Ryle.
Present.
Sarah Parati.
Present.
Shari Brand.
Present.
Stevie Merrill.
Present.
Todd Hermio. Vince Martinez.
Present.
And Vivian Gellert. $17, we needed 16.
All right, we have a quorum. Thank you very much, everyone. All right, to start my report, we just wanted to thank and recognize one of our former members who is here today, Jim Hayden. Thank you for joining us post the end of your term on EMS Council. We did acknowledge you to some degree at your last meeting in September, but we wanted to formally acknowledge you with a plaque to thank you for all your years of service, both on this council as well as to the EMS community. So just wanted to say a big thank you. I know Roy Riles wanted to speak as well on your behalf.
Hey, Jim. Roy. A lot of history there. Jim and I go back 30 plus years now. When I first met Jim, he was working as an EMT on an ambulance, and I think you were out in Glendale, weren't you initially?
You keep saying Jim, you only know me as Jimmy. Roy.
Well, it was Jimmy back in those days, but he grew up. He worked in field for a number of years and ultimately became union president of the local I-60 of the IEFF, representing all the field employees. And that's when I really got to know Jim, because we sat across the table from each other for many hours negotiating a CBA between the company and the field employees. And one of the things that always impressed me, even though we disagreed on a fair number of topics, one of the things that always impressed me about Jim is his advocacy for the field employees and everyone that worked in the field. As a result of that, a number of years later, he became a member of management, and I thought that was poetic justice. He now got to manage the people that he wrote the CBA for. So that was an interesting change of the way he did things, and continued in management for many years until he left EMS as an active member in the field or in administration, and started a bunch of businesses, a very successful entrepreneur, but he remained active both on the EMS Council and most importantly, I think, was the founder of an organization called Stop Our Stigma, which is stopourstigma.org, which is a not-for-profit foundation to target the abnormally high suicide rate of EMS and fire personnel. And he is on the board of that, as is Dr. Bradley. So thank you, Jim. And on behalf of all the people that you've worked with, my wife, who thinks a great deal of you, and myself, congratulations on your retirement from the council. And we appreciate all your service to the EMS community.
Thank you, Roy.
Thank you, Jim. So I don't know if you wanted to say any word, not to put you on the spot, but we do have a plaque for you here. But a big thank you for all of your continued work to help support the EMS community across the state of Arizona.
My comment that I make is, if you haven't clicked on the pledge for stopourstigma.org, the pledge for everybody to go on and sign. If you are a healthcare professional, you can sign it as a professional. It's geared toward educating family members. We as EMTs and paramedics get lots of training on our ability to know when we're having a bad call. But all too often, we all have many friends. We've been to the funeral. We could look at each other going, I was the last person to know. Who would have thought that person would have committed suicide? And then the comment is made, well, it wasn't suicide, it was an accident. And we all know that's probably not true for many of the funerals that we've been to as EMTs and as medics. So paramedics have a 39% higher rate of suicide than the general public. So our nonprofit is 100% dedicated toward reducing that number. We won't eradicate it, but our goal is how we do this, actually educate family members and friends. So your loved ones that see you and they know that you're acting a little bit different to be able to say something. So you see something, say something to them as well. I founded a nonprofit and actually it is endowed, which means 100% of the administrative expenses forever are paid for. And that's been endowed by one donor, and the intent behind that is to make a difference as it pertains to as a professional. But Roy, I appreciate your comments. We tried shot a couple of days ago at a luncheon where a bunch of EMS old people got together and told lies. But it's been an honor and a thrill be involved in the EMS now for 40 years, believe it or not. And Dr. Bradley, thank you very much for your leadership, and the rest of the people that are online and here in person that I've been friends with for a large part of my career. It's been a true thrill, and not going away, just going away from the EMS Council. But thank you very much.
Yeah. Well, thank you very much, Jim.
You want a picture, right?
Yeah. Let me zoom. Perfect. But one more, Dr. Bradley. Thank you. Got it.
Thanks.
Yep, that's the pledge. Yep. If you're not gone there, go there. There, I'm there. Do it. Donate $39.
All right. Well, thank you. All right, the attendance report is in your package. Just a reminder, if you do miss 2 or more consecutive meetings, the Bureau will reach out to you to confirm whether you'd like to remain on the committee as a member. We would like to welcome new member, Dr. Sharav. Welcome to EMS Council. So thank you for joining us today in person as well. My pleasure. Thank you. We do have several vacancies. The vacancies, we have 3 current public members, ambulance service corporation representatives, physicians specialized in emergency medicine from local EMS coordinating region, specifically Western region. If you are interested in applying for any of those positions, please submit your application to the governor's board and commission website that is listed on the agenda as well. The terms are 3-year terms. If your term has expired or is nearing expiration, you can also apply for reappointment at the same website as well. And we just want to briefly touch on the naloxone leave time program. Dave Hansen, are you on the line? Otherwise, I can cover that, or Adam.
Yeah.
Okay.
I can cover it if you
Yeah,
like.
absolutely. Thank you.
The naloxone leave behind program continues to expand. We have 47 partner agencies as of last week. We have over 3,500 individual EMTPs in the state trained, and that represents about 15% of the total amount of EMTPs in Arizona. That's fantastic. We're approaching 5,000 kits shipped to agencies, and of those, about 560 have been left behind actually with at-risk patients or at-risk people on scene. And we believe that number to be a little bit lower because perhaps not every single leave behind incident is being scanned into our system via QR code. So we think the numbers are a little bit higher than that, but we're very, very pleased with those numbers. And so if you'd like to participate, it's a low barrier. We need a letter from your medical director, and we need to do a little bit of training, but otherwise it's completely free and very easy. So if you would like more information, contact me or dig in.
Thank you. And I just want to say a big thank you to all the agencies that are participating in this program. It's really remarkable that we have 47 agencies across the state of Arizona. I don't think we had any expectation we would near those numbers of participating EMS agencies. And pretty remarkable the number of EMS providers that have also completed the training on naloxone leave behind, which really focuses on not just how to identify the right patient population to give the kits to, but also in terms of decreasing the stigma associated with substance use disorder. So a big thank you to all the agencies, EMS providers, and medical directors who are supporting this program. We really feel this is true benefit to the citizens of Arizona. So a big thank you. All right, next, moving on, we will go to the Bureau report. This will be a little bit of a tag team session of a few of us covering different topics in this. Shelley, if you can open the slide deck, please.
Okay, so hi everyone, I'm Nicole Dupuy-Witt. I'm the Assistant Director of Public Health Preparedness Division at ADHS, which includes the Bureau of EMS and Trauma Systems. You don't normally see me probably or hear from me, but you will be seeing a little more of me while we are continuing our recruitment for our Bureau Chief. So both Dr. Bradley, myself, and our Deputy Adeline are making sure that we keep the wheels on the bus as we move forward. That is an open recruitment, so it has been up since November. If you know people who would be great candidates for us to consider, please continue to encourage them to apply. We are actively working through that process and continuing to interview, and we are committed to making sure that we find the right candidate for this role. We know how important it is to both our Bureau and our state, and certainly all of you as our stakeholders. So I just wanted to give an update on that. Noreen can give more information on other positions that we're recruiting for, which are all on your screen. We know there are a lot of vacancies across the Bureau right now, and we're just being very cautious as we add new positions, and definitely considering our budget with each position that we add. But we have a lot of recruitment happening right now, and I don't know if Noreen wants to add anything on that position.
I don't think so. We have also the trauma compliance. That's the position that reports to Kim. Kim has moved up into my old position as the section chief, so we need to fill her position. If anybody's interested in working with Kim and coming on board with trauma, they're more than welcome, and we encourage them to apply. CON administrator, we have positions recruiting for the CON team, and enforcement, we're recruiting also for our enforcement section. And the certification manager is recently vacated by Maria Dominguez. And so we have a lot of, positions open, and welcome your participation. If anybody that's interested, the Bureau is a great place to work and spread the word.
The only other thing I just wanted to say before we move on to the other update. So unlike Rachel, I'm not an expert in everything that the Bureau is doing. So we'll do a little bit of a roadshow on our update, but just wanted to thank you all for finding this room that we're having our meeting in. And I know Dr. Bradley acknowledged there has been some changes in some of our time. We have some room that you're used to going to is under construction. I know we have the igloo, which now is also under construction. And so we'll continue to bring updates as we move and try to make it as easy as possible. We're hopeful that we will find a permanent place that we will hold these meetings that's suited for everyone. We are doing some shifts in our 150 building. So really looking at our business needs and moving around in the building. So that'll be also happening over the next few months. So we'll bring updates on any changes that might impact our walk-in service or our meetings in the future. But just bear with us. Appreciate you accommodating all the changes. And it looks like most of you found this room. So that was good. I'll pass it on to the.
All right. All right. So next, I just want to touch on our upcoming awards for the EMS and Trauma Award. Next slide. So this will be our year 3 of doing the EMT of the Year Award. The information for that has gone out to the 4 regional councils. So if you have not received the information, you can reach out to your regional council. Next slide. We just ask when you do nominate individuals to consider these factors, years of service, leadership, etc. Next slide. And these, the slide deck will go out to all participants after the meeting with the direct link. So if you do not have this from the regional council, you can also nominate someone directly if you have anyone in mind that you would like to nominate for these awards. The 2025 Trauma Awards are also going to be coming out. This will be in May as well. This is our second year of doing the Trauma Award. Next slide. Again, kind of things to consider when you do nominate someone for these positions. And this one, we are just going to run through some of the category nominations for this. We have the Trauma Program Manager of the Year, Trauma Medical Director of the Year, Trauma Registrar, Injury Prevention Achievement Award, Research and Academic Achievement Award, and then a Pediatric Champion. Last year, we did not have any nominations for a Pediatric Champion. So if you do know anyone that you feel is worthy of this, pediatric trauma care, please take the time to nominate them. We'd like to make sure we nominate someone, as we do see many people helping to improve pediatric trauma care across the state of Arizona. This is the direct link for this. A reminder, Bureau staff does not participate in any of the review or decision-making on this, as we are the regulatory body. The councils each will select their own EMCT of the Year award, and there is a committee that is outside of the Bureau staff that will review all the trauma nominations and make a recommendation for those awards. Next slide. The nominations are due March 7th. And timeline for this, winners will be selected in April. They will be notified, and then we're very fortunate that we have a larger room space available for our May 8th meeting, where we will give out both the EMCT of the Year award as well as trauma awards. We have recognized, we have quite a few individuals that like to bring their family members when they get recognized, which is wonderful, but we've run out of space in the last couple of years. So we have been fortunate to get a larger room for the May meeting to hopefully accommodate the recipients and their family members. Next, I will turn it over to Likia to cover the EMS portal changes.
Good morning, everyone. I'll give a quick update on the EMS portal changes. So we've been asking everyone to please update the rosters. Please continue to do that. We've been working on syncing the EMS portal with ACP, so we can have an accurate roster of all the employees. Please make sure you update those. We have the instructions on how to do so on the LMS public portal page. And that's going to be ongoing. So please make sure you keep that up to date. The next update that we have is the email that you're going to be getting from BEMSTS once you submit an application or create an account, or all the correspondence from BEMSTS is going to come now from ACDHS at Arizona BEMSTS.license.com, and they will no longer be from no reply at Arizona at acdhs.gov. That change is going to happen this month. So make sure you bookmark the new address. Make sure you let your IT department know, because now instead of being .gov, it's going to be a .com address. So make sure you keep an eye out on that. And then the last update, we've been working on updating the website and then all the applications and all the merge templates to include the new logo that we have for the state and the new colors that we have with the state. So if you have any questions, just let us know. I know we have a glitch on some of the emails that have been going out with the logo, that it looks bigger than what it should be. So we're working on that. But if you see anything, just let your regional coordinator know, and then we'll get to working on that and fixing it. Thank you.
Thank you. And just I wanted to really highlight on the top of the agenda is the new color scheme and logo for ADHS. So if you do receive any emails or communication that is not spam, that is the new logo. Just want to make sure people are aware. And then also really make sure your providers know. Many people feel very comfortable opening emails from a .gov email address, but the certification is a .com. So just make sure your providers know when they do the recertification, if they have to do that themselves, that it will be coming from a .com email address, just that they do not delete that to spam. Next slide, please. All right, David Harden, we're gonna.
Good morning, everyone. Good news, the statute rule book has been updated as of January 21st. It's on the Bureau's website under regulatory references. It includes statutory and rule changes that were made during last year's session with GERC and legislature. And then also, I just want to give a great update on the Governor's Office of Highway Safety and the grant program. The Bureau has been a collaborative partner with GOHS since at least 2006 on various highway safety initiatives, particularly with post-crash care and other aspects. We've had 2 grants this year we'll be applying for the third one. But this report's trying to get an idea of what we're doing as far as the data. So for example, when you get the grant from GOHS, use this federal highway funds, and the data side, you have to be able to demonstrate improvement in at least one or two of the six performance metrics pertaining to highway safety data improvement, like timing, accuracy, completeness, integration, uniformity, that sort of thing. One way we're doing that is we're finding ways to use EMS and trauma data in conjunction with the DOT's traffic records data on crashes. So for example, by using the trauma data with and DAV peers data and DOT data, it helps us to collaborate with GHS on the 24-26 state highway safety plan. And then also the ADOT 24, that's the 5-year strategic highway safety plan, that's past October. And then right now we have the injury prevention and the time-sensitive injury components within the 25-30 Arizona EMS and trauma system strategic plan that's pending approval. So there are some aspects with that. And also we have the ability to use geocoding with our GIS folks to be able to do some heat maps with the pedestrian crash data. So an example, I'm going to skip over this to show what we're doing as far as visual. This was a pedestrian safety puzzles, two of them that RB on its list for their EMS for children's program manager developed. They put together a work group to help facilitate this under the grant. She spent some time researching it, using the data to develop the questions and the field. Well, she had the one that a word search version and also a crossword version. She's also working on pedestrian safety as our topic, because that's the leading cause of crash-related injuries in Arizona and fatalities. So what we're doing is she's putting together a collaboration with the Arizona Department of Education, DOT, Government Office of Highway Safety, and ADHS to work with the high school drama clubs. They have it put together 20-30 minutes skits on various aspects of pedestrian safety. And one way this helps us to achieve the acceptability of our data is it requires the students with their teachers and their parents to go to the websites like these, for example. On the Bureau's website, the DQA section for the portals and the visualization, you can download that information and use the data to develop your skits from that. So it helps us to show we're improving on the accessibility of the data. And then the other one, like here, for example, that's the one we linked with DOT's crash forums is also linked to our website. And similarly on the DOT's website, we put links to our data forums and data visualization reports for crash and the trauma and the EMS database. Other than that, that's pretty much it. Again, if anyone's interested in applying for the GHS grant this year, the one category that's applicable to acquire in EMS is the Rural Flyers grant to purchase education equipment to help reduce on theme time. Feel free to send me an email if any questions about that. I first send you the link to the website where you can look up the grant requirements. Any questions? Thank you.
Thank you, David. All right, next, I just want to briefly touch on scope practice updates. I know we had mentioned that this was coming at our September meeting, but as of January 1st, we are officially live with the updated scope of practice, which includes the critical care endorsement along with EMR. So this is a huge improvement for the state of Arizona. So we're really excited that that has been approved. Alongside that, there's also the updates to the drug tables. I just wanted to really point out some of the bigger changes on table 3B. This is specific to hospital-based paramedic. We have updated based on MDC's recommendations, the medications which are really more delineated for a critical care endorsed paramedic have been moved to that column. We've added more oral and topical agents for general paramedic working in a hospital setting. So if you do utilize paramedics, just want to make sure that you review that list to make sure your hospital is compliant with those standards. Table 1 has been updated to add both the EMR column as well as the critical care endorsement column. And we're really excited to see this program rolling out in the state of Arizona. So Just wanted to point out that that was approved. A huge thank you to PMD and MDC. This was a big lift to review updating scope of practice, as well as the drug tables for the state. And not to leave behind, I think we have touched this already,
Yeah,
actually.
I think I mentioned everything I'd like. I can cover items B and D with the next slide.
Okay.
So, the depth of the EMT, Emergency Medical Services for Children, produced a program called the MARC program. This is the counterpart to the Hospital Recognition Program for Pediatric Excellence. And so this program is open for application to EMS fire agencies. And the goal of it is to increase pediatric readiness. The program is designed with an application period, and that application closes February 14th. Please contact me or Everett Smith if you're interested in participating in that pediatric excellence recognition program for the services. And next slide. Yep. And a quick update for Share. We continue to work with our hospitals to maintain their cardiac receiving and referral recognition. We're also working to finalize the Share database in preparation to produce our annual report. Passionate Report is another resource that can be found on our website, and reach out to me if you have any questions. I also have a counterpart in the Data and Quality Assurance Department that is Josephine Johnson. We're both working on it. So if you have any follow-up questions today, please feel free to reach out.
And next update, just a reminder, EMS Council did approve, I believe it was last May, the addition of the shared cardiac arrest data element to be a premier EMS agency. So that data reporting period started January 1st. So this is just a reminder that historically when the SHARE program was first developed, many of these cardiac arrest elements were actually gathered by hand in a narrative by the team, and that was how we gathered the information for that report. Obviously, technology has improved significantly over the last 18 years, and we really know with NEMSA 3.5, the new data standard at a national level, that all of the cardiac arrest elements are in your EPCR platform. And so the goal moving forward is to get that data element directly from your EPCR. That will make a much more streamlined process and also allows us to gather data more real time for EMS agencies. So effective January 1st is when that data collection started. We are starting to look at how that data comes across. I know some agencies have been asking, how is our data looking? Because of the fact that we're not yet even at the end of January, we just want to reassure people we are not going to take anyone's PEEP status come March 31st. Really, the goal of this is to kind of improve how the data comes as an automated data set into our platform. And as we start getting that data, we will be communicating out with everyone so people know how their agency is looking. But just a reminder, this I think will be a huge improvement for our overall cardiac arrest data in the state of Arizona. And we know with the SHARE program that cardiac arrest data has really made Arizona one of the leaders in cardiac arrest resuscitation nationally. So a big thank you to EMS Council for supporting this change to the PEEP program. And like I said, hopefully agencies can feel more comfortable. We are starting to look at that data, but it's going to take us a few months to see how that is going to look moving forward. And lastly, just want to quickly touch on our GIF page. This has a wealth of information that is available. I really wanted to point out this slide deck will go out to committee members. This has links to our trauma centers, CON holders, cardiac receiving and referral centers. But one of the most important things that we've seen, if you look at this in our next slide, which is, I believe, our data dashboard slide, is that we do know some EMS agencies in the state are actually utilizing this data to apply for federal grants and get funding to support projects. So this data is available. There is a wealth of information that Bothwell and her team put together in our trauma and EMS dashboard and continues to do so. And we have seen some pretty sizable grants in the multi-million-dollar range that some agencies have gotten based on the data that is available on our website. So really want to plug that information and encourage people to visit the Bureau's website, specifically the Data and Quality Assurance section or DQA section. Next, I will turn it over to Carissa for our trauma registry update.
Good morning, everyone. So we are happy to announce that our RFP has been concluded. We sent out an email a couple of days ago, but if you missed it, ESO was granted that award. So we'll continue to work with them. We have moved over our web-based trauma centers to the new ESO patient registry as of January 1st. They'll be closing out all of the 2024 records in our old registry, Trauma 1, and all 2025 records will go into the new registry. And this is is for the web-based facilities. And then the next big part of the project will be migrating over the legacy data from Trauma One into the new ESO patient registry beginning July of this year. And then there have been a lot of questions on the financial data upload and then the ICD-10 ISS scores. So those are a part of the RFP requirements, and they're not currently in place in the system. So we'll be working with ESO to make sure that those topics are addressed. We'll work on those as we go forward. There are Q&A meetings every Tuesday for the full data set facilities and every Wednesday for the reduced data set facilities from 1 to 2. And those are for the registrars or trauma program managers to ask questions about the new registry. And then if there are any questions for ESO, they can reach out to traumatraining@eso.com to submit a support ticket, or they can schedule a one-on-one meeting and go over any questions they have. They're also, the registrars and the trauma centers can also reach out to me with any questions. So does anyone have any questions for me on that? Okay. It's been a long time coming. So thank you to everyone for your patience who's been a part of it. And we're excited to move forward and get going in the new registry.
I said this at the earlier meeting, but I'll just echo what Krista said. It has been a very long process. So we just want to thank everyone for their collaboration, cooperation, and patience, and definitely Carissa and Kim for supporting, especially over the past few months. I think we had a really speedy process to get everyone into ESO. So I think everyone was happy to know that our RFP awards is where it is, and there's a little less work going forward, and we're in a good position. But I just want to acknowledge that our RFP process was lengthy, and appreciate everyone's patience through that. I guess I should put the last two updates. So David had just acknowledged that our new rule book is up, so we just wanted to make sure everyone is aware of that. Also, just to note that we did update, so we did go through the process. We, being the team, went through the process to look at our guidance documents and our substantive policy statements that are on the website and make sure they align with any changes within the new rules. So those have been updated, and where there were policy statements that are no longer needed were removed. And so just, you're free to look at the website. That's all been updated. We can certainly answer any questions if you have any. And then just wanted to give an update on the strategic plan. I think originally we had communicated that we would start working and looking at work groups. We have a couple members of our team who are out, and with the transition of our bureau chief, we're just going to push that a little bit. So we hope to be able to bring that conversation to next meeting, and then really start digging into the strategic plan and the work groups and all of that work. So just wanted to acknowledge that we aren't having the conversation you thought maybe would be today, but that we are on track and we'll bring it to the next meeting. And if you have any questions, I'm not happy to answer them.
Thank you, Nicole. And just for attendance purposes, I do see two of our members did join us after roll call. If you can maybe just confirm your attendance, Dr. Godbranker. You can come off mute or in the chat as well to confirm your attendance. And then also Brian Stevens. I did see both of you join. If we can just get your confirmation for meeting purposes. All right, moving along the agenda, we have an update. I think, Shelley, you're going to be giving the TEPI report. Is that correct?
I got a message that he had to go to clinical duties. So I will give the TEPI summary. They approved their meeting minutes as presented. Adam Rodriguez shared information from the TEPI Share User Group meeting that was on November 6th. Julia shared info on the pedestrian data opportunity and outcome of the ADOT and DOHS grant work group. If you want any more information on that, please contact Aubriana Smith. They also discussed pros and cons of displaying the number of agencies that report to AZ peers. It's not a voting item, but consensus was they agreed to an annual number to post on the snapshot area of the data dashboard. The group looked at the ADHS heat-related surveillance dashboard. They also talked about pediatric drowning data. And then Adam shared the application, the areas that they were streamlining on the Heart Safe program. So if you need any more information on the Heart Safety Program, please reach out to Adam Rodriguez. End of report.
Thank you, Shelley. Next, Brian, the Education Committee report.
Good morning, thank you. The Education Committee met on November 21st. Our minutes were approved as presented. Dr. Dan shared info on the psychomotor exams that are required at the end of programs that are required by statute, I believe, but are no longer required by national records because they thought to be completed as a part of the program to meet Arizona requirements. And so on those psychomotor exams, the program director and the program medical director can generate and attest and then submit results to the state. We have approved our updated safe sleep training and toolkit. It is now posted. We approved TXA training, which is now posted. Julia and Rachel shared slides showing the outcome of the tournament educational grants to the regions. The drug delivery bulletin and announcing the update to the scope, drug tables, and certification and training rules was revisited. Voted to approve forming a joint work group with PACES to make a training for children and youth with special health care needs. The first meeting occurred on January 16th, and there will be a second meeting to be determined yet. Members and attendees requested for the upcoming March 2025 meeting to add the A.R.S. training institutions pass-fail rates for first attempt on the paramedic exam finals. Also request to add pass-fail rates for the psychomotor assessment and a request to form a work group on the testing process. Our next meeting will be March 20th at 10:30.
Right.
Andy?
Yes, thank you.
We approved our minutes as they were presented. Dr. Bradley shared the process for updates and drug tables. If a member suggests the drug be added, Shelley have the sheet to collect the request and we'll bring them to the next agenda. The delivery bulletin now in the update to scope, drug tables, and certification and training rules was revisited. Dr. Bradley thanked the members and attendees for the work on the update. There were some medication reports for 911 and inter-facilities that were presented and reviewed. Members discussed potential for training and discussed difficulty with getting good, clean data into EPCR. Some suggestions shared: make epinephrine one line in the future reporting and or change away from ratio name, which I'd like to make comment on. The USP hasn't recognized ratios for at least 6 years that I know of. So I think that would be a good thing to make that go away because they still show up in a lot of EPCRs. Our next meeting will also be March 20th, 2025 at noon. Thank you.
Thank you, Brian. Next, our regional council report. We'll start with you, Roy.
Yeah, I'll defer to the written report that you have in your packet. I will like to just point out 3 things quickly. This year, excuse me, is AIMS' 50th anniversary. And we don't have the date yet, but it's probably going to be October, November. We're going to be having a big party, not funded with any DHS money, all privately funded, trust me. And we're looking forward to having, there's probably going to be a theme, and it'll probably be some sort of ancient thing that goes back to the 50s or 60s or somewhere along there, but it should be a lot of fun. If you've hung out with EMS people, you'll know that's the case. So that's coming up. Also, our 25th anniversary EMS Honesty Conference, our 25th year of EMS Honesty Conference, coming up on June 12th of this year via Zoom. It'll be a Zoom meeting. And we're really excited to have Donnie Woodyard, who wrote a book on artificial intelligence and its application to EMS. He's going to be one of our keynote speakers. So that should be really interesting about AI and EMS. And lastly, there's information there on the OBLS grant study. That is a study that AIMS is involved with, but it's not just for the central region. It's statewide impact that we're working with the grant from the University of Connecticut on doing OBLS training throughout the state. There is a hyperlink there if you read the report online. If you have interest in it or have people that are interested in either becoming educated in OBLS or OBLS instructors, there's a place to fill out an interest form And so take a note of that, especially if you're outside of the central region, because you might not hear of it otherwise. Otherwise, I'll defer to the report. Thank you.
Thank you. Next, Sarah for SAM's report.
Good morning. Thank you, everybody. I too will defer to the report we submitted respective to SEAM's activities. However, I do have one amendment, and that is our next meeting is scheduled for April 15th. And I'll submit that to Shelley so she has the revised date, at which time we will be doing our chair elections. That's all I have. Otherwise, I'll take questions. Thanks so much.
Thank you, Sarah. Next, Vince for names report.
Good morning. I have submitted the names report for all to read. We do have one important announcement. NAMES is presenting the 16th Annual Pediatric Symposium on March 3rd and 4th in Flagstaff. We welcome you to participate in this awesome pediatric educational opportunity and to come play in the snow because we finally got some last night. Please go to our NAMES website to register, and the flyer is also attached to our report. Our next meeting will be February 7th. Thank you.
All right, thank you, Ben. Next, Rod for Western Region report.
Howdy. We had our first meeting of the year on January 9th up in Parker. Our next meeting is May 15th in Lake Havasu City. That will be our annual meeting. That's our next in-person meeting. And I am working on the provider assistance for this fiscal year, finishing them up as we speak. And that's about all I got.
Thank you. And next, PACES report from Dr. Woolrich, who you will see pictured on the back of the pediatric symposium flyer as well. So just to plug that,
Okay.
Dr. Woolrich.
Yes, thank you very much. We had our last PACES meeting November 21st. We had a series of presentations. Botzell shared information in the Quail Kids and the ATV program. Morgan Anderson presented the information from the annual report of the Arizona Child Fatality Review. We had Dr. Gaither, who presented his quality improvement toolkit and EMS training materials. These were posted to the Bureau's website within the share tile. Adriana reported an update on our Safe Sleep training and toolkit. That was a joint production between Education and PACES. That was approved at Education and is also going to be posted to the web. You can find more information about all of these presentations in the meeting minutes. As for our voting items, we did approve our minutes as presented. We approved our EMS PEC, Pediatric Emergency Care Coordinator role description guide, as well as our hospital PEC role description guide. We approved a joint work group with Education to create a training and possibly toolkit for children with special healthcare needs. We had our first meeting on this earlier this month, and our second meeting to be determined. If you'd like to join this work group, please reach out to Adriana. Lastly, we were going to vote on our bylaws, but this was tabled, and we wanted to assemble a work group to revisit some of the language in our bylaws in regards to term limits, proxy voting, and members. Our call to public, we had Chris McCarthy, who's a representative of the Western Regional Alliance for Pediatric Emergency Management, presented and spoke about a pediatric project called Disaster Response Collaborative, which focuses on improving pediatric disaster preparedness in hospitals. Again, refer to our minutes if you'd like to reach out to Chris McCarthy regarding this project. I think that wraps it up, and I thank you.
Thank you, Dr. Woolrich. And I do want to plug just some of the education curriculum that both PACES and Education Committee have put together for any agencies looking for training as we come upon our national registry timeframe. There are a number of really well done education curriculum that are available on the Bureau's website. Your agency can download those and give that to your personnel for CEs. These are updated on an every 3-year cycle, so they are kept up to date via several pediatric specific ones. We have a new TXA edition that was mentioned by Brian, and then also on the ACS field triage for injured patients. So just want to make sure people know that those are there, and please utilize those as needed for your training purposes.
Thank you.
We will move to our discussion and action items next. Shelley, if we can display the meeting minutes. If I can get a motion to discuss and amend approve the meeting minutes from September 19th, please.
Motion to approve.
All right, that's first and second in the room. Thank you.
I love it.
It was Roy and Dr. Madam. They did it together, so.
Beautiful.
Any recommended amendments? All right, hearing none. Any opposed? Any abstentions? All those in favor say aye.
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 Thank you. Next up is the PEEP data elements. I did cover this a little earlier in the Bureau report, but did want to also open this up in case there are any questions. As I mentioned, we have been getting some questions regarding these data elements, but just wanted to make sure we had this under this discussion section in case there were specific questions regarding this. One of the things that we did discuss internally, which I think everyone in this council was aware of as we went to looking at the PEEP data elements, we were going at a January 1st start date. Previously, the PEEP data was done on a off calendar cycle, so it kind of went November through February for the quarters, which is somewhat difficult to do. But as was approved for this new data reporting to start January 1st, the PEEP data elements will start on that quarter cycle beginning January 1st of 2025. So I don't think there's any significant change, but just wanted to make sure that everyone is aware of that as well. Next, we just wanted to mention, as we do have the critical care endorsement that is now available for application purposes. We do have that. Dan, I don't know if you wanted to speak to that briefly. We can maybe click on the hyperlink so people can see what that looks like.
Yeah, I can talk to it super quick. Really, or I can wait for the, so in essence, you would have to log in. So you'd come to this page, you log into your public portal, obviously if you're a paramedic, and then you would go to your application section and apply for the EMCT paramedic critical care endorsement. It's going to ask you a few questions, but the big part that we look for is you have uploaded a certificate so we can verify that you have actually taken the critical care course. Once we do that, then we will assign you your critical care endorsement. Just for GWIZ information, current data is we have 222 critical care endorsed paramedics at this point. Other than that, that's all I have as far as the application process.
Thank you. That was going to be my next question to put you in your spot because you had the data already, was to see how many we had. So we weren't sure how many we're going to apply out the gate. This went live January 1st. So we're not officially at the end of January. So that's pretty significant. So we're really excited to see that program taking off. And that dovetails next into the CON rate adjustment. So Mike, I will turn it over to you for that discussion.
Okay, I'm hiding behind the pillar, so I'll come out. You can go to the next one. So critical care transport. Thank you. We have some Arizona Administrative Code rules in place that help us with the pricing. So as you can see, 251107D talks about we need to consider additional costs for critical care transport above ALS and BLS. The main one here, item 2A, critical care transport, is at least the amount of specialty care transport used in federal Medicare guidelines. So when we took a look at that rate in federal Medicare guidelines is 18.2% greater than the ALS rate. So, and that it's referenced, we got a reference there about where we got that from in the Medicare ambulance fee guideline. Shelley, next one. So I just put the example up there. These four CON holders have an ALS rate, a BLS rate, and then a critical care transport. So it's simple math. You just take the ALS rate, multiply it by 18.2%, and that's your new critical care transport rate. So, next one. So the process to get this, the first thing I want to tell you is the portal is open right now, so you can apply today for this rate, for any of you that need to do that. It's a two-step process. Your CON needs to be amended to have that level of service. So you'll have ALS, BLS, critical care transport. So we'll accept those applications to amend your CON. And then next one, Shelley. And then the second step is applying for the critical care rate. So also the portal is open for that. So we don't have to process one and wait to do the other. We'll do those simultaneously, our staff. So if you're to the point where you're ready to apply for critical care rate, just remember it's a two-step process. And Aaron and I and Tony can help you walk through it. But it's amend your CON to show that you're doing critical care transport, and then apply for the rate. And the rate will be 18.2% above your listed ALS rate. Any questions?
Is that finalized, 2.2%?
It's finalized until Medicare would change it. It's right now today, it's 18.2%. If they change it, then it'll change it.
And is a CON amendment subject to, it's automatic, it's not subject to a hearing or anything of that nature?
I don't believe so, but I don't have final, I don't have final word on that from our legal team yet. So I'm sorry, I can't answer that today.
I see online, yes, Vince?
Yes, thank you. You know, at the last meeting of the group, when we talked about this, we talked about our concerns about using the Medicare rate. It was too low. And as it stands now, the unregulated critical care rates or the specialty care transport rates we've been using, this is a huge cut, actually, and a decrease in the amount that we've been typically charging when we do these nurse transports. But now that they are regulated, I must say that that 18% is way too low. I don't know of a standard out there or a rule that says that we have to do this. I think it was arbitrarily chosen, and we should retake a look at this because it definitely is not going to help fund the critical care transport level of care, that the equipment, the training, and everything else that goes with this. Thank you.
Okay, Vince, this is Mike Grasky. I'll give you a call and we can talk offline about this, but I'll be interested to hear your comments. Okay.
Does the CON amendment process place an agency into a position where their timeline response requirements will change? For instance, will agencies that have a set requirement of percentages of extra unlimited responsibility, that is it going to change that or force it into a different time component?
You're talking about on your stated response times on your CON?
Correct.
When you apply for critical care transport rate, I believe we'll be asking you for response times for that particular service.
Okay, will that change the?
No, it will not change. Okay. No. Sorry, I mentioned. Yep.
Has there been an analysis on the differential and extension between critical care and less support rates and extension?
I couldn't quite hear what you were saying. You were saying, is there an analysis?
I'll repeat myself. Was there an analysis of the difference in expense of critical care service and life support service?
Yeah, there are.
Okay, and that supported the 18% difference.
We did two things simultaneously. So we looked at the statute that we need to charge at least what the federal Medicare guidelines are, and that's the 18.2%. And then we took a look at incremental expenses related to providing critical care transport versus ALS service. So we did those two analysis kind of side by side. Thanks. Darcy, have a good. Sorry, can I ask a follow-up question? It's kind of based on that. And the analysis that you found showed that the 18.2% was going to cover the cost of creating a critical care program at an agency. Because the amount of cost to training, buying equipment, I mean, all that is far more than that 18.2% reimbursement. But it's a good question. And what our analysis found is that it more than covers in some cases, and then it does not cover in other cases because a critical care transport, everything wrong that could happen, may happen. And they're using all kinds of drugs and they need multiple pumps. And then some are going to be very, very minor. So it was kind of in the middle somewhere. So I don't disagree that it doesn't cover everything in all cases, but it more than covers in some cases. That makes sense. Okay. Yeah. Okay. Thank you, everyone. Dr. Whitman.
All right. Thank you. So next on the agenda, any agenda item to be considered for the next meeting? Hearing none in the room or online, call to the public. Hearing none there as well. Upcoming events are listed on the agenda. I will not read those off to you. They're also available on the Bureau's website. Our next meeting, just a reminder, our meetings this year are off the third Thursday of the month cadence, but we do have the calendar published and a hyperlink in the agenda as well. It will be May 8th at 10:30 a.m. We should be in a large conference room again to accommodate the award ceremony. So looking forward to that. And if I can get a motion to adjourn, please. Okay. Thank you.
Thank you.
Thank you.